table. Okay. And then loosen up the belts. Now, some patients prefer to leave the belt on while they sit up so that they're, still getting that compression and it feels good. I'm always a little concerned about passing out, so I like to undo the belts lying down. It doesn't really matter. It depends on the therapist that you're going to be working with and your experiences. Once we loosen up, we just give it a second for circulation to adjust, because remember we provided a compression through the abdomen. Okay. Then you want to just make sure you very gently kind of rock the pelvis a little bit, and that's so things adjust. You've separated things. You want things to kind of adjust back in position before you start moving them and add weight to the spine. Okay. And after I know that he's adjusted, I take this off. Now I'm going to remove the legs from here. So what I'm going to do is I'm going to lift this out. When I do, just bend your knees and put your feet flat on the table.
Okay.
Bend your knees, flat on the table. This out of the way. You can pull your shirt down. You can take your arms out of this.
That's a stinky.
Yeah, it is. All right, and then he's going to roll onto his side like a log.
Ooh.
Okay, and then bring your legs over the edge. Sit yourself up. Okay, just give him a second. Any dizziness?
No.
Usually with lumbar there isn't, but sometimes with cervical there can be. So I'd lower the table if I knew where the thing was, or have him scoot forward so your feet are on the floor, because it's easier to catch somebody if your feet are on the floor. Ask him how it felt, change in pain level. Okay? So that's lumbar traction. The setup is the biggest part, right? Setting up the belts, getting them on the table right. Okay? Make sure you give him the safety switch. The thing about lying him on it and setting him up, I'm going to have you stand up for a second, is that sometimes you can't really guarantee
Here?
Mm-hmm. And then turn and lie down. Straighten yourself out. The problem is, if this is too low, you have to start having him bridge up. So then I would need to kind of lift this up. And the thing about this now is that, okay, oops, it's not even. I'm not going to get an even pull, because this one's too far forward than the other one. So now I have to kind of start shifting them. And so in the end, if you're going to do a good traction treatment, you're better off doing it standing, because now you know you have it on where it's symmetrical and it's pulling. And I have actually seen patients on traction with one side pulling way forward, and what is it doing? It's actually twisting them, right? Usually you don't want to twist a disc if it's a disc problem. The other thing you can do with this unit, which is kind of nice for cervical traction, is that you can create a side bend for traction. So if you're trying to emphasize one side of the neck, if they have radiculopathy, and you find with manual traction they do well with side bending, you can add a side bend to it. I guess theoretically you could do this with pelvic traction also. Create a side bend in the prone position. Kind of open up one area. Never done, personally have not done it, but. Okay, so that's lumbar. I would prefer if you only did lumbar over here. You We do have kind of a funky setup where you could do it over there. The table doesn't split. You have to use a slippery sheet. It gets very weird. And I would just assume you practice cervical there, okay, just to get the idea. You should know how to set up both machines, because you don't know. I may split the stations and have cervical there and lumbar here, and then another stem modality there and some stem modalities here. Not for the same person, but okay. So you need to know both machines, how to do set up. I'm not going to switch them though. I'll tell you right now. So how long it took me just to put them back. Okay. So any questions on the procedure? There is a lab sheet that actually walks through the procedure of how to, the order to do things in general. I'm not as crazy about the order. You'll see that there are like 20 steps. That was the original sheet that I wrote down from Dr. Z. So yeah, it looks like, but in general, make sure before you start the traction, they're in the right position, the pads are in the right position, on the table where the split is, and they have the switch, and the parameters are correct. Okay, then you can hit start. Okay. And then the process of breaking it down. Make sure you loosen everything up first, make sure everything's kind of gives it a second to resettle, rock the pelvis a little bit, then you can remove the stool, and then once you open up all the straps, they can slowly log roll to the side and sit up. And lock the table first. Lock the table first so you don't forget. Very easy to forget. Any questions on traction? So you want to, there are another set of traction pads that you can practice lumbar setup, because you need to practice that, believe it or not. That's actually the hardest part of this, is putting on those pads. So that's going to take you the longest time, and that's what you need to practice. Yeah, absolutely. Then you get a little alcohol wipe and you wipe them down. Because they're going to make you sweat. That's what the point is, attached to the skin. That one's cloth. That's kind of upsetting, isn't it? Yeah. Yeah, it's kind of a rubbery, clothy like. I don't know. I have nothing to say about that. Now this unit